rate. They said pregnancy rate 34 versus 39, 13.9%. And there are papers saying that it brings you better out. In one paper. So we agree to this. And they say CPR statistically significant. So they say, but here they say that when we do, I don't, the difficult cases can be done easily. But I still don't say that you should do IUI. This is one paper only. They're not guidelines. But you can use it in case you want to use it, but that doesn't do wonder in case you have done your assessment properly beforehand. And in case you know the depth of your uterine cavity, not recommended. Does the type of catheter affect IUI outcome? It doesn't make any difference. All the catheters are the same, but for IUI, we normally use a firm catheter. We don't use a soft catheter. All the catheters, they're good. Nothing to worry about the catheter. All the catheters, they do well. So, soft versus hard catheter. So, they say that no evidence that any catheter is better. You can use any. We are using firm catheters only. Volume of inseminate affect outcome. So, debates are there, but normally we take 0.4 ml. We don't cross that because in case we take more, the fluid may track backwards and cause the problem. They may go inside the peritoneal cavity. So we are limiting ourselves to 0.4. This is what you have to do. That's the speed and technique of IUI. So speed and technique, definitely yes, you should do it. There's no time intervals given. This is what will happen. The catheter should go inside the uterus without force, without damaging the endometrium. Very gently, it should go inside. Stiffer catheter, if cervical stenosis is there, and this we should do. I always say we should do mock IUI in every patient nowadays. With a soft catheter or a hard catheter, do a mock IUI like we do mock ET. Do it, and it helps us. Avoid using Eddie's forceps, but you can use it in case you have difficult transfer. Then, how to inject a sample? Sample goes in 30 to 60 seconds approximately. So 30 seconds means count till 30. 1, 2, 3, 4. So this is don't inject too fast. Gently push it. Count till around 20, 25, 30. That's the way we do it. How to remove the catheter? Remove the catheter. I normally say recommendation says it takes around 1 minute. But normally we don't take so much of time. We just go inside, inject, and within count of 10, I remove my catheter. But some guidelines go to 60 seconds. Bed rest for 15 minutes is important. Give it a 20 minutes, it doesn't make a difference. In IVFET, it is not recommended, but in IUI, it is recommended. No, some people elevate the eggs to not need it. Bed rest, nowadays we say 15 to 20 minutes is what I recommend to all. What to do if the catheter is not going in? Catheter is getting stuck. Then you can use ALIS. First of all, fill the bladder. So in case that your uterus is retroverted and you fill the bladder, then it will become more retroverted. It will help you in antiverted uteruses, not in the retroverted uteruses. Remember that. So here it may straighten the canal, but full bladder will always lead to more angulation in retroverted uteruses. Ultrasound guided, absolutely good. Use a metal cannula to just make a small opening, then you can go in. Intercourse after IUI, yes. For all, yes, yes, yes. Tell them to be together. So their being together will improve their hormonal milieu. When to cancel the cycle, how to prevent ovarian hyperstimulation. So when on the day of trigger, there are more than 2 follicles, more than 15 millimeter, or there are more than 5 follicles, 10 millimeter, that day, that cycle you cancel. So we don't want HCG coming in pregnancy and causing ovarian hyperstimulation later. How many cycles? We don't know. But I feel that we can go till 9 cycles, 3 cycles, but I recommend only 1 or 2 cycles, or maximum 3 cycles. The thought I leave for you is very clear that simple method, lesser